we'd be sitting at a table and we would have a third-party agent bring in, and they would have quotes from Blue Cross and Humana and United and whoever else.
When your renewal comes up, it's whatever it is, and you've got to decide whether you're going to take that increase or go to another bigger plan or whatever.
Plan A, Plan B, Carrier A, Carrier B.
We never talked to any representatives of the company. All they sent us was numbers.
The big insurance companies, they're worried about Wall Street, worried about their stock prices.
It's just getting more corporate, larger. We're all seeking anything that still has some tangible personal value to it.
We want to control our costs at our bank's level, and we want to control our costs at the plan level, and that takes a lot of people pulling in the same direction.
When you join Advantage Health Plans, you join this family of great bankers, great business people, great stewards.
Being a member rather than just a customer provides us more access, more ability to give feedback.
I can call if I need to and have a say in what we're doing next year and how we're doing this.
That's a very unique quality of Advantage, is that y'all will get engaged and do a deal.
The depth that Advantage Health Plans went to make things work for companies, and the people depending on the coverage in the companies, was very impressive.
That we had better options and more options than we would under a traditional plan.
Health care, health issues aren't all cookie cutter.
That's kind of the key of Advantage, is that you're bringing a whole different paradigm to the equation.
That kind of personal attention that that we never really got when we were with a bigger carrier.
I can be underpriced for some products if someone's big enough to do it, but I can promise their service isn't the same.
And with Advantage, they want to be solvent and do a good job for their members. But the profit and the bottom line is not the focus of their operations.
Occasionally something was so unique and so far out of the control of the insured or the bank covering it, and it was just something that the board would sit there and know they needed to help those people.
Y'all stepped in and worked with both the employee and the provider to reach a mutual agreement to be able to provide services in the local area that we're in. So I think that's been a real benefit, that y'all are so hands-on.
Having somebody that's an advocate that has an interest in bargaining on your behalf as well, and so for me, that firsthand experience really, kind of sold me on the trust and the plan.
My employees are grateful to have that tangible personal value that comes with the Advantage Health Plans.
If you want to have control, you want to shop responsibly for medical services, Advantage is a good place for you to be.
It's unique that they have pioneered looking for providers that are willing to price their services at a fair market rate, and not the way a lot of providers have done for years is you don't know until you get the bill in the mail what the costs of your services are.
We need to shop for medical services the same way we shop for everything else. And because we haven't done that, that's the reason medical costs are going the direction they're going and at the rate they're going. We're medical consumers out there, whether we're in Advantage or we're in some other plan. We're medical consumers, and we have options, we have choices, but we need to make informed decisions when we're purchasing non-emergency medical services. And that's what Advantage is trying to facilitate. And they give us, Advantage is giving the participants a lot of tools to do that.
It's been a much better way to help manage that process and keep that out-of-pocket, maximum out-of-pocket number manageable.
We're going to try to minimize the inflation through smart choices, teaching our own members and team members to shop smart.
I know over the last 4 or 5 years, our costs have went up dramatically less than what medical inflation as a whole has went up, and that's because of what we're doing and our philosophy, I think.
They do a great job, and you know, I don't see any area that they could improve upon what they're doing.
I put a questionnaire out to the team, just, you know, would you want me to shop for other insurance, just broadly? And I got back a unanimous no.
What we found is a very successful solution for healthcare for our firm.
It's better for the bank and it's better for the employee.
We've been with Advantage for 40 years.
I am Advantage Health Plans.
I am
I am
I am.
I am Advantage Health Plans.
We are Advantage Health Plans.